Well, first off, someone who wants a facelift is someone who has gone through the aging process and have noticed that their cheeks, their jowls, their necks sagging, there's more wrinkles, they don't have the youthful look they had anymore. And that's pretty standard to how this proceeds. Everyone, as they age, goes through this process by one, losing volume, laxity in their skin, or sometimes they gain weight and they get more volume in there. But generally it's because they've lost the volume, lost the elasticity of their skin. What a face and neck lift does, it not only lifts and tightens the tissues, but also sculpts out the facial features, the jawline, the neckline. And there's a lot of things we can do to help give that a good result. Sometimes it's just tightening the underlying tissues. Sometimes it's some liposuction in the neck and face. Sometimes it's adding fat to the face. It's sometimes doing eye surgery as well to get rid of excess skin, bags in the eye, lifting the brow. There's a lot of combinations we do to give them the best result. But what the patient needs to decide is what they're willing to go through for what kind of result they want to have. Sometimes it's minimal, sometimes it's a lot. But my job is to teach them what their options are and what can give them the best result. I do tend to use different forms of facelifts to give different results. The woman who has just minimal problems, I do what we call a mini lift or what we call a short scarf lift, called by many different names, but it's basically a mini lift where you don't have to cut behind the ear. There's also the full lift, which is the most commonly used one, where you have to cut not only in front of the ear but behind the ear to lift and tighten the neck. I do like to tighten the muscles of the neck so it has a nice sculpted, youthful look. The most important thing is getting the volume back in a face. And that's why I like to use at least, fat transfers and putting fat in the face. Not to make them look fat, but to give them back some of that volume that they had when they were younger. And if you look at a youthful face, you'll see that there's a much more volume in the face than they do with an older person.